First of all, good evening those in India and good afternoon to my friends in UK. Last 9 months has been very turbulent, trying times for all of us throughout the world. A little virus has literally brought us to a standstill. The universe and the world has to rethink, recast where we are going forward. There's no enemy. This is known as the invisible enemy. We all are fighting worldwide, all the scientists, doctors, so we are trying to fight this invisible enemy. Let me give you a bit of scenario of UK. UK comprises Scotland, Wales, Northern Ireland, and England. A population of 70 million. The population of 70 million is managed by 38,000 GPs. Very orderly, organized healthcare system, one of the best in the world, I can say. I think whoever studied in London can vouch for that. So all of them have access to a GP at the point of care, free of charge, nothing. That is the system in UK. Right, now coming back to, there's only so much that doctors and scientists can do. But there are far much more than individuals like us can do. Very simple. As I said, this invisible enemy, the virus is there to kill. Very simple, basic things I said. Hands, face, space. No matter what you do, just wash your hands, cover your nose and mouth, and space yourself with the virus. This is the biggest weapon we have got within ourselves. That is fundamental. There's the Trinity. That's a mantra. All right, now get back to our science and medicine. We have evolved and discovered a vaccine. The first vaccine was done, you know where, in Germany itself, but the other vaccine is developed in Oxford with the help of AstraZeneca, but fortunately manufactured by your country, Serum Institute, one of the largest manufacturer of vaccines. We have 100 million doses of Oxford vaccine in stock and 40 million of Pfizer vaccine in stock. We have started rolling out. We have got a committee known as Joint Committee for Vaccination Immunization, JCVI. We have Public Health England and we have MHRA. All these bodies have regulated all that. Somebody said the politicians are involved. Here it's political scientific medicine. The 4 states have got its chief medical officer, chief scientific advisors. They all get together to come back to a synchronized single policy. Of course, India is very difficult because of 1.3 billion, 20, 30 odd states. It's not easy as this. But fortunately, I come from Singapore, born and bred in Singapore. Singapore is well controlled with a population of 5.4 million. But let's not talk about Singapore, let's talk about UK itself. Whatever said, done, there's enough vaccine. We got 140 million doses for 70 million people, double doses. Up to today, we have done 2.5 million doses vaccination has been done. I myself have booked for Monday to get my first dose of vaccine, right? The plan and the target is to roll out 2 million vaccination every week. Come Valentine's Day, we hope to achieve 15 million people vaccinated itself. Of course, there are side effects. Of course, there is a lot of fallacy, a lot of thoughts about it. Each individual has their own value. But on the basis of the whole thing, this gives you protection. I'm not saying it gives you 100% protection. It gives you at least 70 to 90% protection, depending on what type of vaccine it is. And also, let me remind you, the moment you get a vaccine doesn't mean that you got antibodies. It takes 2 weeks to develop antibodies. For the 2 weeks, you still maintain the mantra. What I said, hands, face, space, the 2 weeks itself. Then it kicks in. Our second dose, Pfizer vaccine is supposed to be 21 days, but now we have revised it to 12 weeks. Why? The 2 reasons is that we can spread the vaccine more to reach more people than the small quantities itself. By the time Moderna will be here, by the time Oxford vaccines, the supplies will be there. The only other mantra, apart from hands, face, space, is vaccine. You got nothing else, my friends. You got nothing else. There are side effects. When you walk out, you get knocked out by a car, you take aspirin, you get allergy, you take paracetamol, you get allergies. So my humble request to everyone, if offered, take it, right? If not offered, I do not know. So coming back to, we have about 27,000 centers, whole of UK. UK is only a state like Tamil Nadu, 70 million population. We have such 27,000 sites to deliver vaccination. And I said early on, we're hoping to give 2 million a week. By Valentine's Day, 15 million, that means 20%, 20% of our population will be vaccinated. Why you vaccinate? The reason is the vulnerable are the ones most affected. People with underlying pathology, diabetes, hypertension, obesity, asthma, cystic fibrosis, these are people affected. So we were trying to prevent. The system here is different from the Indian system because we have old people's home here, elderly people's home, right? They are the top priorities. Those in that, and the care workers who give care to the elderly are the second priority. Then comes 80 and above. Then comes the healthcare frontline, like us, frontline workers. I've seen, my clinic does PCR testing, antibody testing. So far, I myself, my clinic has done about 1,000 PCR tests up to today, right? The rate of infection are increasing. Coming back to one thing, there is a variant to that. It's a virulent variant virus. Was developed in Kent, it's discovered in Kent. The other variant is in South Africa. Let me touch you. Some say that the vaccine will not affect this. So far, all the study shows that vaccine is effective, whichever the variant it is for the moment. Future, we do not know. Right? So the question is now, India is bigger, 1.3. I can't get into your political situation or economic situation. This virus is not only affected health, mental health, physical health, social health, the economy, the very fabric of our social society has been affected. You can't see your father, you can't see your parents, you can't see your grandchildren. This is what is happening. It is disoriented. A tiny virus is disoriented the whole social fabric of our society. The only way forward is the 3 mantras plus vaccination. This is where I come from, and I urge everyone, if you get a chance, please do vaccinate. I think India has brought out 2 vaccines. Bharat has brought 1 vaccine, and the AstraZeneca Oxford vaccine is manufactured by Serum Institute. And the population, at least here, there's a lot of space. People move around. We can give space. The society is disciplined, but not as disciplined as my society in Singapore, but nonetheless, British society is disciplined. What we need in India is a bit of discipline, a bit of education. People are people everywhere, right? 1.3 billion can be managed itself. That I leave it to your scientists, politicians, and whoever it is, right? But the model, Tamil Nadu can emulate UK model because same population. You're much bigger, right? And land space, we are smaller, but your population density is higher, no doubt about it, right? But I don't know how you're going to manage the situation. That's your prerogative. My take-home message to all of you is this. Simple, I said. It's not rocket science itself. It is just wash your hands, cover your face, space. And if offered vaccination, you take the vaccination itself without any questions or doubts itself. The other thing, let me give you a bit of statistics about so far the world has got 91.6 million infected cases. Let me repeat, 91.6 million cases in the world. Our country, UK, has got 3.16 million. The death so far in UK has been 83, almost 84,000. The worldwide death is about almost 2 million. If the vaccine had been available at the time, 9 months ago, we could have prevented all this. Right? I'm not, as I said, the vaccine may be 70 to 90% effective. This is the startling factor. If you don't need, let me give you a statistics. Today's case, we had 46,000 infected cases in UK. Let me touch a little bit on the lockdown itself. There's no mantra, there's no magic. If you don't, as I said, the kids take the disease to the home, the elderly get infected, but the kids recover. The immune system is robust, they recover. The elderly gets affected. What we are trying to do is stopping the virus reaching the vulnerable, the aged. That's what we are doing. So where the social gathering comes, not elderly people. It's the young boys, young girls, go to party, go to pub, and all that. This is social gathering is there. So if you bring down, the lockdown is strict. UK is total lockdown till the 14th, till the 15th of, because Valentine's Day, next day is, they're going to review. The rumor, the lockdown might be even severe next week itself. Cabinet is meeting, I do not know. So there is no mantra about it. You don't meet, there's no disease. You don't touch, there's nothing happens itself, right? I think the take-home message from UK and from Singapore, as I said, Singapore has controlled it so beautifully. Zero, our own people, is all imported cases in Singapore. Right? UK is trying to do that itself. So I leave this to a little bit of knowledge I can impart, a little I know, but you know, I had the privilege of born and bred in Singapore, studied in Stanley Medical College, graduated with University of Madras degree and working in Harley Street. I will correct you, Harley Street is not a clinic. It's not a hospital. It's a clinic. I look up to about 10,000 patients, worldwide patients we care. We do COVID testing for all of our patients, and we are trying to get some vaccination program into the vaccination program itself. Thank you for giving me the opportunity to interact with you guys. And if you have any questions, if I can answer, I'll try and answer. Thank you.
So thank you so much for your very interesting speech. And firstly, thank you so much for your time. So I have a question. So there's a conundrum. So countries with really good healthcare, and most of Western countries, more specifically Europe, there have been high mortality in those countries compared to developing countries such as India, South Africa, etc. So what do you think is the reason for the same? So why are developed countries having high mortality with regards to COVID in comparison to developing countries, or is it because the testing is kind of low or the reporting is low in developing countries?
These are multifactorial. Europe is an aging society. If you look at the number of deaths, it's the elderly. Whereas 70% of your population below the age of 40, whereas 70% of population of Singapore is below the age of 40. I told you the immune system is very robust. One. Second, you touched on something, reporting system could be China reports differently, Nigeria reports differently, South Africa different, the differing culture. Whereas UK and Singapore, you can't deviate. What is what? Black is black, white is white. The reporting structures are there. Right? Europe is the same thing, reporting. You can't fudge your statistics.
So then I have one more question. So I did read an article in The Economist, I think not recently, but sometime in May, sometime in July, which said that since COVID does not affect young people or does not affect them significantly, the schools could be reopened. Schools for children until the age of 17 could be open. At the same time, in 2 weeks' time, I saw an article from Times which said, no, opening schools for kids is a bad idea. So what do you think? What is your opinion on the same? Schools being shut for indefinite period of time. I think who loses the most in COVID is kids, and not kids from privileged backgrounds, but kids from really impoverished backgrounds, and more so in India where kids who come from families in which parents are not educated, who can't homeschool them. That's why I think it affects the most. So what is your opinion on the same?
That's a very good question. There's multiple answers to the question. Early on I've said, young people are very robust, but they're the carriers. They're contagious. They are the ones spread. So the teacher doesn't get the COVID. The children bring the COVID to teacher. The teacher. That's why I suggest the teachers should be vaccinated. That's the program we are doing. The teachers and the carers should be vaccinated. Right? In an old people's home, the carer is a young person. She looks after the elderly person. She can be infected. So this is where you coming back to schools. It is the kids can take where do you get the flu? When you get fever, it's the children from kindergarten school coming back, the parents get the flu, get the infection. Am I right or wrong? They bring the viruses home, right? They mix around with the kids, They might not be asymptomatic, but if an elderly parents at home who's got underlying pathology, he will get infected himself. Right. You said education. Education, whether rich or poor, education is baseline, same. Of course, if you got that online support, here you get online support. Whether you come from socioeconomic group, lower socioeconomic group or higher the syllabus are same, the teaching method is same, there are 40 students a class, the same lecturer gives the same online teaching. So the support mechanism is pretty strong and pretty tough in Singapore as well as here. Let me give you a bit of example. Singapore has got no water, rubber, tin whatsoever. We only believe in education. Can you imagine our young society, if it's not educated, the future will be, our future will be zero. As I said, we only have a little bit of brains. That's all. And the brains is training, skilling, education. That's all. Right? So you have to develop mechanisms. You have to develop systems that is conducive for the time. As I said, there's an invisible area, enemy. We have to fight the enemy. Different armaments are different. The social background different. Education is different. We can't be sitting down and saying, okay. But in a way, the virus has changed the methodology of delivering medicine, the methodology of delivering education, the methodology of reacting. This is not going. It is going to be online. That's why if you look at the stock market, tech companies are booming. Online marketing, online shopping, they all are booming on the basis, right? Online education is booming, right? So all the traditional brick and mortar organizations are suffering.
Though you have problems on vaccines, I think that's why there seems to be a lot of controversy, and more so in India. So we have a lot of. So I have three questions. The question one is around the Indian vaccine. So there have been. I've also asked the doctor from Kaveri hospitals on the same, and I'm also going to ask you the same. So there have been a lot of controversy which says that Indian vaccine did not follow the standard procedure and probably it could be not safe. So I would like you to answer on the same. And second thing, there have also been a controversy on the Oxford vaccine, which says that the efficiency is low, efficiency is 65% to 70%, and so on and so forth. And third question is, there have been different vaccines such as Sputnik, again Oxford vaccine, Pfizer, and Moderna, and they say so different columnists write different vaccine is better. So in your opinion, which vaccine do you think is the best, or which has the highest efficiency and the efficacy?
I'll tell you the first question. Whichever vaccine is available, take it, grab it, take it. Whichever vaccine. There's no choice. There's options choice. Because there are limited supply, short supply of vaccine worldwide. There are 7 billion people in the world. And the vaccines are no way, it doesn't cover even 10% of the population itself, right? So whichever vaccine, whether Moderna, which is, we have just approved Moderna, whether Pfizer, whether Oxford vaccine, if it's available, grab it, take it without second thought itself, right? That coming back to Indian vaccine, I can't comment on this one, but then I must emphasize that Oxford AstraZeneca vaccine is manufactured in the Serum Institute of India. You are exporting 100 million to us to UK, right? UK is using it, Singapore is using it, most of the countries using it. I leave the judgment to you and to your society to decide on the basis. I'm not here to propagate, you must use. And coming back, the difference transportation. You see, it's the Pfizer has to be transported at minus 42 degrees. In tropical countries, in India and other countries, it might be difficult. Transportation might be difficult. Where Oxford vaccine is like normal vaccine. You put in the fridge, zoom, you take it out, zap it, and and it's done and dusted. That is the logistics are going to be a bit of a problem for third world countries. Oh, sorry, my apology, emerging nations itself, right? So this is where it is. Efficacy, the first dose gives you about 70%. The second dose is within gives you updates to about 90%. That's what the Oxford vaccine is. That's what all the vaccines are. No vaccine is 100% guaranteed. No matter we vaccinate 7 billion people, there will be 10 to 20% with the vaccine still get infected. I'll touch you another subject. That doesn't mean that you had your COVID, that you must be exempted from vaccine. I don't believe in that. The science doesn't say that. Today, Singapore doesn't do that. UK doesn't do that. Whether you have COVID or not, go for your vaccine, get the vaccine done. Otherwise, your antibodies develop it. You might develop antibody, but nothing like having the vaccine stuff, right?